Nurses campaign to win Medicare for all. All right? I have one thing I'm going to ask everybody in the room to do, even if you're at a table. So come forward, grab a sign that's on the chair. This is how I start everything off, just so we're like all on the same page here. There's signs on the chairs. Everybody, and we're going to take a picture, fists in the air, holding the sign. Then I'm going to blast it all over the interwebs. Oh, the sun is behind you. That's not good. All right, everybody, what do we want? Want it? Right on. All right. Thank you. Thanks for indulging me. We'll probably do that again at some point in the event. So I'm not going to stand up here too much more. I want to introduce to you a wonderful activist in the area who's part of the Our Revolution Mass chapter, one of the leaders, Nancy Stenberg. All right, everybody. So, I don't? Okay, I forgot I had a microphone, sorry. But I am here to fire you up. So, who is ready to help us win Medicare for all? All right. That was pretty good, but I am also a retired educator, so we're going to have to do that again. 10 times louder. So, who is ready to help us win Medicare for all? Better, thank you. So the purpose of this meeting is to plug you all into the work that will pass Medicare for all. And just to distinguish, this is for a national level, although we are thrilled to have our state Medicare for all people here. Deb, raise your hand. Very good. Okay. So our goal is simple, to put overwhelming grassroots pressure on decision makers, specifically our Congressman, Richie Neal. That's why we're here in, okay. That's why we're here in his district today. So we've got a jam-packed agenda. Let's go. First, we're going to take a few minutes to get to know each other. Yes, we're going to do one of those icebreaker things. Remember, I am a retired educator, okay? Then we're going to recap where the campaign is today, our plan to win, and how all of us fit into that strategy. Then we're going to go over our volunteer program, answer any questions, and before we leave here, we're going to plug you all into that campaign. Here we go! Very good. It's almost like you guys read my script too. Okay. So, as you know, my name is Nancy Stenberg, and so I would like you all to turn to the person next to you, and those of you who aren't sitting next to anybody, you're going to have to get next to anybody. And please spend a couple minutes explaining why you came here today to that person. Okay, thank you very much. And now to get the program going, I am going to bring up one of our city councilors here in Springfield, Jesse Letterman, who is the chair of the Committee on Health and Human Services. City Councilor Jesse Letterman.
Good afternoon, everybody. How are you? Good. I'm City Councilor Jesse Letterman. It's my honor and privilege to welcome you on behalf of the City of Springfield and many of our constituents across Springfield who are also in support of Medicare for All. I see some great activists out there from the Springfield area. Wonderful to see you, and to those of you that have come from near and far in Western Massachusetts, we're glad to host you. You know, I first had the opportunity to really learn about Medicare for All and why that was so important a few years ago when I worked with a great gentleman by the name of Dr. Don Berwick, who some of you may know, who was a candidate for governor here in Massachusetts and has championed the right to health care for all people around the world. And serving on the Springfield City Council, and especially on the Committee on Health and Human Services, I do a lot of work around the issue of health disparities in Springfield. And we know that one of the causes of those is the historic disenfranchisement of many of our constituents across Springfield as a result of being uninsured and underinsured. And we see that impact. We see it now in the opioid crisis and the inability of folks to get the treatment that they need and the beds that they deserve because they're uninsured and underinsured. And that's just one example of one of the reasons why it is so important for us to reform our healthcare system, and why I'm proud to support the state legislation that's been put forward, and why I'm excited to see the movement at the national level. So we stand with you in the city of Springfield, and I plan to continue to support this movement. I want to thank Nancy and the nurses for bringing everybody out today. But again, as I was saying to somebody when we first came in, all politics is local, and it all starts from the ground up. That's how I got involved in this fight. That's why I'm proud to stand with all of you. And again, welcome to the city of Springfield. Thank you.
Thank you.
I'd like to hear Don Berwick's name brought up, because he's one of the guys that got me on the start here for Medicare for All. Larry Cervelli from Progressive Democrats of America. This, you may or may not know PDA, but organized in 2004, we're a federal PAC, and we've been involved with Medicare for All practically since our inception through the Healthcare Not Warfare campaign. We've been aligned with the National Nurses Union for years, and without a doubt, they are a major force in making this move forward. And you're going to hear from some of their members right now. I'm here to introduce Patty Healy. She's an RN. She's with the Mass Nurses Association. Again, another forward-looking organization designed to bring all of us together to make this happen. Patty?
Yep, thanks. I'm a proud member of the Mass Nurses Association, and I would like to say that the Mass Nurses Association for 25 years has supported the concept of single payer and Medicare for all, and worked closely with MassCare. We've put our dues money into it. It's been really important to us, and we are thrilled that we are finally building a movement across the country and here in Massachusetts. And I think what's striking is that we're now seeing 85% of Democrats who are polled are in favor of some sort of form of Medicare for all, and even 52% of Republicans are in favor of Medicare for all. So it's pretty amazing. And it's actually even a litmus test now for those presidential candidates coming out, as you probably have seen. Many give sort of lip service, but aren't really committed yet, so that's part of what our campaign is. There are several nurses out here in Western Mass who are working on Medicare for All, and I also want to just say that I've also worked on the state part of this movement, which is Western Mass Medicare for All. And we've been able to see that the biggest part of the movement really is here in Western Mass, so it's important for us to build this movement here and reach out to the rest of the state. So I'm just here to say welcome, and I do have two other nurses to introduce. One is my co-worker from Cooley Dickinson Hospital, Candy St. Jean, and she's going to just say a couple of words, and we'll move on to the program. Thanks.
Thank you, Patty. Again, my name's Candy St. Jean. I'm a registered nurse. I live in Wilbraham, and I work at the Cancer Center at Cooley Dickinson Hospital. I'd like to tell you what my fellow nurses and I are seeing at the bedside. Every day, patients come in far more acutely ill than they would have if they had insurance or a more comprehensive insurance coverage. A diabetic whose health could have been managed through regular doctor's visits and medication ends up in the emergency department, experiencing a wide range of complications from vision loss to kidney failure. An individual with high blood pressure who cannot afford his medication winds up with complicated and expensive cardiac surgery. Hospitals are not the only facilities feeling the effects of a failing healthcare system. Untreated mental health and substance abuse conditions often land individuals in our criminal justice system. This is not the way a nation or a state should approach healthcare, which is a basic human right. This problem is not limited to those who lack insurance altogether. I see it every day in the outpatient cancer center where I work. People today have more comorbidities coming into a cancer center, to a cancer diagnosis today. I see them struggle financially, and part of my job is to do prior authorizations to get insurance companies to cover what they need. That includes anti-nausea medicine and pain medication. High copays, deductibles, and inadequate prescription coverage can have the same effect as no insurance at all. Those who are underinsured will also forego necessary care and end up in the hospital sicker than they otherwise would have been. And for those individuals who do eventually seek care in our hospitals, if they lack adequate insurance or have no insurance at all, they can be left bankrupted by the costs associated with one adverse health event. By instituting a Medicare for All program and providing quality, comprehensive health care to all, many more would seek out and receive proper preventative care and would be able to afford to manage chronic conditions more effectively and diligently. Nurses and patients know that we cannot afford the current broken system. Patients have been paying for it with their lives. It is not sustainable for patients. It's not sustainable for the nation. It's time for Medicare for All. Now I'll call up my colleague Donna Stern, who will explain more about what we all need to do to make Medicare for All a reality.
Hi, everyone. How's everyone doing? Okay? We ready to do this? Yeah! Because why else would I be up here? I'm going to be asking a few things. So let me just tell you who I am. My name is Donna Stern. I'm a registered nurse. I'm a full-time registered nurse at Bay State Franklin Medical Center. I work on the inpatient lock psych unit, which I think some of you have probably heard that Bay State is going to be trying to close. So this is all part of the same fight, okay? Because we're talking about access to health care, but we're also talking about maintaining the health services that we have. I am a proud member of the Massachusetts Nurses Association. I'm the senior co-chair of our bargaining unit, and I serve on the board of directors. And I couldn't be prouder to be part of an organization that has been so committed to doing whatever is possible to make this happen. So, we know we had a little change in the House, and we have some Democrats now controlling the House. But I think we all know that not all Democrats are created equal. Can we say that?
Yeah.
Can we say that? Yeah. Okay, I have a slight opinion about that, but I will keep that a little bit closer. But I really believe this. We have a real opportunity right now to take control of the healthcare debate. And I think despite whether you're a Democrat or independent, socialist, whatever you are, I happen to be a socialist, that yes, rock on, my comrades over there. We have an opportunity to get this done. And because the one thing I hear all the time, despite wherever I am, is that we need real health care. Affordable, accessible, and that's not going to make us bankrupt. And so Congresswoman Pramila Jayapal has reintroduced a new version of the old House Medicare for All bill, the Medicare for All Act of 2019. And that means, what does that mean? Well, I think we all know, once you reintroduce, you have to get a whole new set of sponsors, okay? And that's the work. That's the real work. And I think what was already mentioned before, Congressman Neal currently does not support that. We need to change that, okay? It's a bottom-up approach. We got to put pressure on him, and we got to make him do what he was actually put in office to do. Not his needs, not the corporate needs, but our needs. We know in order to do that, Carolyn's going to be coming up. Oh, you're going to do a...
Yeah, we can do a video.
Oh,
when you're
okay.
ready.
Oh, okay. Oh, I forgot about...
Sean will run the video.
Oh,
when
okay.
you're ready.
All right, Sean, I'm almost done. Almost, Sean. Okay, almost. So we, in order to do that, we have to put pressure, and we have to put lots of pressure, okay? So we're going to show the video, and then we'll go right to the ask afterwards.
Greetings, sisters and brothers, and welcome to the national movement for Medicare for All. We are so proud to be by your side in this fight.
Medicare for All is the moral imperative of our time.
The state of healthcare in the United States today is absolutely unacceptable.
People are dying every day because they can't afford their meds or they can't afford to go to the hospital.
Over 100 million Americans are either uninsured or deeply underinsured.
People can have insurance, but they have these high co-pays, so therefore they don't really use the insurance. And so what good is that?
For nurses, this is just a core value. We understand that every single human being deserves health care.
Healthcare is a human right.
We know from the nurses we represent, emergency rooms get filled up with waiting lines because people aren't receiving the preventative care that could have prevented those visits to emergency rooms.
And what we're seeing is the unnecessary suffering of our patients and at times even death.
Our life expectancy rates are going down.
Every other wealthy nation has a healthcare system which looks after its people.
The amount of money that we spend per person on healthcare is ridiculous. It's greater than $10,000. Why is it that we have such poor outcomes?
You know, our healthcare system is messed up because it's based on making profit, making money. How much money can you make off this person's illness?
Pharmaceutical companies are making $125 billion in profit. For nurses working in a healthcare system that values profit over people has been heartbreaking for us, and it's something that we simply cannot continue to do. People should be able to go to the doctor. They shouldn't have to die. They shouldn't have to delay care. Nobody should go bankrupt
For care that they need.
I think in this country we've seen a tremendous growth for support for Medicare for All, and that is across the spectrum.
The broken, expensive healthcare system doesn't discriminate against your political party. 70% of Americans in general support Medicare for All, 84% of Democrats support Medicare for All, and 52% of Republicans support Medicare for All.
We're just so excited that there is this level of enthusiasm for Medicare for All, and we know that that's what it's going to take. Now we just have to make sure that Congress catches up.
In order to win, we need to have a plan.
For 3 decades now, we have been working tirelessly in the halls of our legislature, at the state level, at the federal level, at our bedside, in the streets, with our patients, with the community, to ensure that everybody has health care security. And we're never going to stop until we achieve it.
We are at the forefront. We know that it's possible.
So for the past 6 or 7 months, we've been working on a brand new Medicare for All legislation.
We are so grateful of Pramila Jayapal and her ability to understand and to listen and to craft and develop in conjunction with all of the stakeholders, nurses and doctors, patients, community, to draft this bill of Medicare for All. The bill that I'm getting ready to introduce takes an existing system, the Medicare system, highly popular, provides health care to our seniors across the country, and it expands it to ensure that every American is covered.
The bill covers a comprehensive list of services, all primary care, all preventative care, all hospital stays and hospital care. It also covers dental, vision, audiology, podiatry, long-term care services and supports for people with disabilities and the elderly. It covers the cost of prescription drugs, mental health care, and substance abuse treatment. The list goes on.
The United States is one of the most wealthiest, richest countries in the world.
We've got to focus our resources where it needs to do the best we can do, and that's taking care of people.
For 70 years, people in the UK have had world-class free healthcare at at the point of need. We built it at a time when the country was on its knees, following the Second World War. So if a politician ever tells you that we can't afford healthcare in the United States, they're lying to you.
The reality is that this bill is going to save the country trillions of dollars.
We will save everyday Americans like you and I money every year.
But most importantly, it ensures that healthcare is a right and not a privilege.
We can't do it just through the electoral process. We actually have to build this movement for Medicare for all. Until we get to a point where our citizens demand it, it's not going to happen because the corporations want to make money.
We're also up against the Republicans, who are trying right now to give people less health care, not more. And we're also up against the establishment Democrats, who think that these watered-down policies that still leave the for-profit insurance industry in the driver's seat are going to be the solution. And we know that the only real solution is Medicare for all.
We can't think small when the crisis that we have is so enormous.
We don't want access to healthcare, we want healthcare.
Insurance is not healthcare. We understand this. People fight every day to get their insurance companies to pay for things that they need.
We know that we're up against a lot in this fight. Winning Medicare for all is not going to be easy.
What big idea in the history of our country has ever been a small idea that moves us in big steps?
We want to take Medicare for all across the finish line.
The next step is we need to push.
Our job is just to demonstrate that it's possible. It's right here in front of us, and we have this concrete legislative path to get it done. Together in the next few months, we are going to knock on thousands of doors, stand outside grocery stores and farmers markets all over the country, and we're going to talk to our own neighbors about our broken healthcare system, talk to them about the idea of Medicare for all and this new House bill, ask them for their support, and ask them to call your House rep.
We need to make the legislators decide, are you with the people or not?
We know that congressional staffers have to track every single phone call that comes in and what bill that it's about. And when you and your community can help drive even a couple hundred phone calls through a couple of canvases to your House rep's office, that makes a huge difference in their support for Medicare for all. And if your House member has already co-sponsored the new Medicare for all bill, that's awesome. You should thank them and then help build support in your community on Speaker Nancy Pelosi, because we're also going to need her support to pass this bill in the House.
The country is with us. We can do this. Together, we will.
It's going to be a historical victory that we'll all look back on, and our children and grandchildren will thank us for.
We are going to win.
Thank you for standing up to help save countless lives.
We're going to tag team this part. So, the organizing we're going to be doing is what they talked about, getting lots of folks to make calls, right? By canvassing, knocking on doors, talking to our neighbors. And we were talking about this before. When you have a conversation with someone and talk to them about health care, people will open up and they talk about what's happening to them, what's happening to their family members. This is a critical issue. I mean, more than 70% of the folks who voted in this last election, healthcare was their #1 issue. So this is not a big ask, really. So the way this works is we are going to ask people to create events, either a canvas event or a phone bank event, and we were able to, with our good colleagues and comrades from DSA, get phone lists for everybody in Richie Neal's district and Joe Kennedy's district. Now, Richie Neal he's the chair of the House Ways and Means Committee.
The most powerful position.
Yep.
At least he thinks that.
Well, it is, because any bill, like this bill, has to go through his committee. And he can stall it. No, we don't want him to stall it. And then Joe Kennedy sits on Energy and Commerce, which is the other committee that this bill has to go through. So through phone banks and canvases, we are going to generate dozens, hundreds of calls into their district. So how are we going to do this?
Well, so the ask is literally asking who's, literally are we doing show of hands?
Yeah, sure.
We're going to do a show of hands. Who's willing to host a canvas phone banking at your house, or want to meet, have it be a meet at your house and do a canvas at like a co-op, a supermarket, just educating people. The goal is to get people educated and get people willing to make that phone call to one of those two or both of those legislators. I mean, that's the deal.
So we're either going to do phone banks or crowd canvas, which is going to a grocery store or a farmer's market or something like that and standing out there with the clipboard, having those one-on-one conversations, or knocking on doors. We use a method called knock every door. You don't just go to a Democrat's door. You don't just go to somebody who's a registered voter. Everybody has a healthcare issue. Everybody will talk to you about this, about their healthcare issue or the fact that they need or someone in their family needs healthcare. So there's 3 things we can do: door canvas, crowd canvas, or phone banks. So who's willing to host one of those events? And believe me, at NNU, that's great, fantastic, wonderful.
Great.
At NNU, and we have a team, and Nicole's part of that team. We are going to support you from the first moment you sign that piece of paper over there to the last time you do your canvas or phone bank. We have all kinds of mechanisms in place to support you. It's like a turnkey operation. You don't even have, so we've got 4. We got anybody else? Anybody else willing to do it? Fantastic.
I actually have a question or two, though.
Well, what we're going to do is we're entertaining questions at the end, right? If you want to come up.